and welcome to our gold participants from around the world. I'm Fiona Lang-Sharp, IBCLC Public Relations Manager and MC for Gold Learning. Well, I'm chatting today with Alexandra Walker. Welcome, Alex. It's great to have you here today.
Thank you, Fiona. It's great to be here.
And Alex is going to be presenting at our upcoming Gold Lactation Online Conference 2017. Her presentation is titled Chasing the Butterfly, Understanding How the Thyroid Gland Impacts Breastfeeding. So that's going to be quite the subject matter, Alex, isn't it?
Yes, absolutely. I think everyone has a lot of questions and hopefully we'll soon get answers.
Exactly. So before we get talking about your topic per se, perhaps you want to introduce yourself to our listening audience today and tell them what you do on a day-to-day basis and what your practice looks like.
Sure. I became a lactation consultant in 2010 after giving birth to two children and realizing that breastfeeding was not only difficult, but also very rewarding. And I just wish that there had been more support. So I decided to become part of that support network, and I became a lactation consultant in IBCLC in 2010. I've worked in the hospital setting, and I currently have a private practice. So I see patients in their home. And I also see patients twice a week at a pediatric practice nearby. So I've seen a lot, and I'm delighted to work in this field.
And so you have a very full life, I can imagine, with your children and work and those types of things.
Yes, I do. And I forgot to mention I went back to school in 2013 and decided to become a nurse after becoming a lactation consultant, so I could know even more and just have more of a foundational knowledge of moms and babies.
Wow, that's incredible. I certainly admire you doing school and having children and working. That's a busy time, but congratulations on that. So it's great to see that you graduated with that too. That's very exciting.
Thank
So
you.
let's talk about your topic now. We were talking offline a little bit about this topic, and we were joking around saying that it is somewhat of a scramble trying to figure out so many things with the thyroid, and yet it's something that's been around for a very long time. But it feels like we're always trying to find better solutions or just really trying to understand it. So why don't you tell me a little bit about why you chose this topic and why it's important to you?
Well, I chose the topic because I think there's a lot of confusion and a lot of misunderstanding about the thyroid's function during lactation. And I think a lot of, in the research that I was reading, I was finding that a lot more moms had thyroid concerns than were actually being addressed and being diagnosed. And what they were thinking as typical postpartum symptoms like exhaustion or depression were actually due to thyroid. And the fact that it's so underdiagnosed and so prevalent and can have such an impact on lactation, it really made me wonder why we weren't doing more about it and why we weren't paying more attention to it. So it was definitely something that I wanted to address.
Absolutely. And can you tell us a little bit about the things that you discovered that were, you know, the things that really spoke to you while you were researching this, and the things that you felt that we were missing in, in the healthcare profession right now?
Um, I think we're missing the fact that you know what? I'm so sorry. Can we stop for a second?
Sure. So, Alex, perhaps you can expand a little bit for me and talk about how in the healthcare profession there seems to be that there is an inconsistency in how we're treating thyroid. Everything from, people being stuck in old, old protocols, and we're not really, sometimes it doesn't feel like we're moving forward. And I know that this is impacting a lot of our families because we do find that there are many women who are breastfeeding today, many more women that are wanting to breastfeed today. So I feel like the demand is going up. Was that something that you discovered while you were working on this presentation, or is this something that you see in your practice as well?
Yeah, I think there are a wide range of things that can influence thyroid function. And I think a lot of times in our healthcare system today, we want sort of a very quick and easy answer, and the doctor only has 10 minutes with a mom. And, thyroid function I was actually very surprised about how much it's impacted by pregnancy, that it has to grow 50% and just goes through massive functional and structural changes in order to keep up with the demands of pregnancy. And then there are women who today are not getting as much iodine as they should be.
Right.
There are increased autoimmune disorders nowadays, as I'm sure we've all heard about, and that can actually, affect the thyroid. And you can have a perfectly functioning thyroid pre-pregnancy and then develop antibodies to your thyroid, but a doctor's
Sure.
never pick up on that, and then that can throw you into a lot of issues once you've delivered as far as lactation goes.
Yeah, it'd be great to have a day where we really have a better, like you, I mean, the word understanding is perfect, I think, but that foundation of knowledge, so that we can, again, every, client is going to be different, but really how to treat them and what the best way is, and not have them sort of locked onto, old protocols. But,
Yeah.
I'm looking forward to that, and I'm looking forward to that day. And without like yourself who keeps pushing forward, and I mean, that's what I love about you too, Alex. I know that you take on those topics that that sometimes people don't look at, but this will be great, to again learn and discover what's happening with the thyroid gland. So lastly, before I let you go today, perhaps you want to share a little bit about what you're hoping, either the delegates, what are you hoping to share with them, and what are you hoping that they'll get out of this presentation?
That's such a great question. I'm hoping that they will feel empowered to empower the mothers that they work with. And a lot of these tests that can be done to detect thyroid dysfunction are really simple and not expensive tests. And I want them to feel like they are armed with good evidence that they can then have a really substantive and productive conversation with their patient's healthcare provider about what their concerns are, why these concerns impact lactation, and what tests we can do to help figure out what's going on, and also feel empowered to make suggestions, nutritional and supplemental and otherwise, for moms that may have thyroid dysfunction. And finally, I think the most important thing is sometimes it can be really hard to detect because they really can, these symptoms can really mimic sort of a normal postpartum adjustment or even postpartum depression. So when lactation and postpartum depression or exhaustion, lactation issues go hand in hand with those things, to take a closer look.
Wow. Well, I'm already absorbed into the topic just with you talking there. So that's great. There's definitely more. There's definitely so much more to this, and I'm looking forward to you sharing with us. And thank you for preparing and putting this together. It'll be great to have a good discussion about this and see what other people's experiences are and find out what's happening, of course, internationally as well. Well, thank you for sitting down and chatting with me today. It's been wonderful having you here.
It's been lovely and totally my pleasure. Thank you so much.
And we'll look forward to having your full presentation. I see that you are going to be presenting on Monday, the 17th of April at our conference. That's the Gold Lactation Online Conference. You can check out your local time for Alex's presentation on our website at www.goldlactation.com. Well, thank you again for joining us today, and for our listening audience, we'll talk to you all again soon. Bye bye for now.